Hello, my name is Charles Jackson, and I will be presenting a mental health report on treating offenders with mental illnesses, a research synthesis. Here's my outline: researchers' credentials, problems to be studied, hypothesis of the study, methodology, the findings, and conclusions, which will include the implications and critique. Here are the credentials for the report. The primary author is a Robert Morgan of Texas Tech University in Lubbock, Texas. He is accompanied by David Flora, Daryl Kroner, Jeremy Mills, Femina Varghese, Gerald Steffen. The article is published in Law and Human Behavior, Volume 36, Number 1, in February of 2012. The Law and Human Behavior is a journal of the American Psychology Law Society, Division 41 of the American Psychological Association. It's a multidisciplinary forum for the publication of articles and discussions of issues arising out of relationships between human behavior and the law, our legal system, and the legal process. This journal publishes original research, reviews of past research, and theoretical studies from professionals in criminal justice, law, psychology, sociology, psychiatry, political science, education, communication, and other areas as germane to the field. The problem studied. In the article written by Morgan titled Treatment Offenders with Mental Illness, a Research Synthesis, the problem explored is what are the effective treatments for offenders with mental illness during their time being incarcerated. The article explores types of interventions that help offenders during their time while incarcerated and reduce recidivism. Research is such an important uh, Research such as this is important to this reviewer because explorations such as this have the potential to change criminal justice system and its approach to dealing with people with mental health disorders. Primarily, the criminal justice system was developed to incarcerate individuals who have violated the law in some form or fashion. While processing these people for predetermined amounts of time, the law allows the offenders who are not fully aware of their actions or who are suffering from a mental disorder can risk not benefiting from the time behind bars by learning their lesson not to violate crime or criminal statutes. Unfortunately, the current system treats offenders the same regardless of mental diagnosis or potential psychological conditions. These people become victims of the system because their actions are not understood, and they continue to act out and get themselves into additional trouble during their stay within incarceration, as well as recidivate once released. As work with this population continues through research techniques that explore treatments, programs, and policy development, society at large will benefit. Individuals are entered into the treatment programs where their mental illness is treated, medications regulated, and behavior is addressed properly through group and social interactions that lead to the outcomes supported by evidence based methods. Hypothesis. Given the findings from treatment with non mentally disordered offenders and psychosocial rehabilitation services for psychologically mentally ill, it was hypothesized that the services would be effective for the domain treated, whereas psychosocial rehabilitation oriented services would be effective at reducing symptoms of mental illness. It was further hypothesized that treatment effects would be unidirectional such that correctional rehabilitation oriented programs would not in would not result in decreased psychopathology, and psychosocial rehabilitation programming would not result in reduced criminalness. Methodology. The review utilized electronic searches of PsycInfo, Medline, and Social Sci apps to retrieve published and unpublished documents evaluating interventions for mentally disordered offenders. A total of 12,154 documents related to the interventions with mentally disordered offenders were identified. To determine which articles were used, the authors developed a coding based on 7 factors that included study, author, and institutional descriptors, sample descriptors, therapist descriptors, group descriptors, treatment and intervention group descriptors slash information, research design descriptors, effect size descriptors. And given that the collection of the studies coded for this article assessed a diverse range of treatment outcomes, they determined that it would be inappropriate to combine all the studies in a single analysis. However, after all coding and categorization was applied, only 26 studies met inclusion criteria. The researchers grouped the outcomes into 8 general categories: mental health systems, coping, institutional adjustment, behavioral functioning, criminal recidivism, psychiatric recidivism, treatment related factors, and financial benefit. The results of the study's findings in the categories were for mental health symptoms indicated a strong positive effect on mental health symptoms, whereas coping, related to increasing knowledge and skills for coping with mental illness and reducing symptoms, indicated a very strong treatment effect. Institutional adjustment indicated a moderate positive effect, while there was a moderate to strong treatment effect. In the area of criminal and psychiatric recidivism, the result of the criminal recidivism is a primary concern to physicians, decision makers, and policymakers. Recidivism is defined in this study as a synthesis. It refers to the reentry of an offender to the criminal justice system or admission to a mental facility, which gives you criminal recidivism and psychiatric recidivism. The review's results produce inconclusive mean effect sizes for both mental and criminal recidivism. The study additionally reviewed therapeutic elements that led to an effectiveness and identified one study that investigated the effectiveness of a comprehensive program addressing mental illness and criminal behavior, finding it to be highly effective in reducing both criminal and psychiatric recidivism. Treatment programs with open admission policies showed positive effects for criminal recidivism and psychiatric recidivism versus those with a closed admission policy. Finally, the use of homework also led to a better treatment result for offenders with mental illness. These homework treatments included practicing new skills or social interactions, and they had a more positive effect compared to those without. Conclusions, implications, and critiques. The examination findings demonstrated that the therapies for offenders with mental illness are successful throughout times of confinement. Research has shown that consistent care has led to better results for individuals with severe mental illness. Specifically, those who experience fewer interruptions in service tend to have better rehabilitation outcomes. This suggests that the interventions during the periods of confinement can have important policy implications. While some stakeholders may want to postpone intensive treatment until offenders are released from jail or another correctional environment, it is crucial to recognize that the substantial therapeutic progress may start during imprisonment. Benefits, together with related community programs, are expected to enhance the likelihood of preventing offenders with mental illness from reoffending either criminally or psychiatrically. Continuity of care is important for achieving desired treatment outcomes and has financial benefits by decreasing the psychiatric hospitalization rates and limiting access to general medical services, thus aligning with public health goals. Mental health practitioners should also prioritize the continuity of care when individuals with mental illness transfer from the community jail. Many individuals with mental illness have been hospitalized for psychiatric reasons before being imprisoned and may already be receiving mental health services. It is crucial for this group to continue to receive those services while in prison to prevent service gaps and enhance outcomes. In an analysis of the study, the researchers studied the effects of treatments provided or not provided to offenders with mental illness by evaluating studies' validity based on their chosen criteria and further evaluated those studies based on their results in categories that offered comprehensive evaluation of results. The hypothesis is based on evaluating the findings from those studies conducted by researchers who implemented the treatments for the offenders. The categories were the limitations as a result of the collective 12,000 studies were pared down to 26 viable options. These categories and stringent criteria for a study to be valid were too narrow for the sample results to be significant. To enhance study results, the researchers could utilize a longitudinal study with a quantitative results-based analysis. Using this method, research findings can be coded on a longer time frame of study, and the results, where recidivism is a factor, can be evaluated properly. Ultimately, research studies such as this one, that is outcome based, can be the platform where studies can be based to evaluate the validity and confirm the results based processes. These people with mental illnesses may receive treatment during their incarceration as well as after by using the results of studies such as this to justify funding for future efforts and research. Thank you.